Everybody, how you doing? It's Dr. Wise. I'm here with Jamie. Jamie is one of my exceptionally amazing surgical techs. And today we're going to demonstrate some talking points about Jamie's non-surgical approach to beauty. Obviously, we're dealing with some great stuff. Obviously, Jamie's very attractive, great skin, great bone structure, all that stuff. A couple things that we like to do for Jamie. She's kind of due for her Botox. And when we talk about Botox, let's talk about the areas that we'd like to address. So the first thing we like to do is we'd like to address the 11s. That muscle that makes that 11 are twofold. There's the corrugator supercilii muscle and the procerus muscles. So you can make that face, please. This is the corrugator muscle, and her procerus muscle is right here. Oftentimes we'll address the forehead horizontal lines, so we can raise your eyebrows. So the forehead horizontal lines here, that's called the frontalis muscle, and that's what makes those lines. And then finally, Jamie, like everyone else, some crow's feet, and that's from the orbicularis oculi muscle. In addition, we always like to give our patients a little bit of a brow lift. Remember, we're not interested in making people look, shocked or look like The Rock. That's good on those folks, but not good on Jamie. So what we do is we like to create like a slight, subtle brow lift. So we'll get that brow up a little bit, but it's important not to raise it way, way high. The other thing that we oftentimes see with Botox is people come in who've had Botox elsewhere and they look very tired, their eyes look very closed. People are like, well, we don't like Botox. Well, if you don't like a painting, you don't blame the paint, right? So Botox has nothing to do with that. If it's done properly, it should come out really, really great. So these are just things to think about. In addition to that, we're gonna do some masseter Botox. Masseter Botox, it does two things. The first thing it does is people who have grinding at night and who clench or get headaches from all that stuff, from TMJ issues, it could be extremely helpful for that. So what it does is it weakens the masseter muscle, which is one of the muscles of mastication or chewing. That essentially lightens up the load on the jaw and creates less tension. So it works really, really well for that. In addition, cosmetically, masseter Botox can actually thin out the jaw. So a lot of women and some men who want a slimmer jawline or a slimmer contour, more heart shape to their face, will often elect to do masseter Botox. Botox, generally speaking, as many of you know, lasts anywhere from 3 to 6 months. I would say it's in our practice, we use a high concentration of units. Usually we get at least about 4 months out of it for each person. So we have Jamie now in our examination chair, and we're gonna do some tiny little marks for the Botox. So this is when we do the 11s. We're gonna hit all these different muscles in the right position. A little bit of a slight brow lift, which is always very, very pretty. This is when we take care of the forehead. And as we move down, a little bit in the crow's feet. Left-sided crow's feet. Good. And then when we do the masseter muscle, this is one of my favorite things to do because it's so unbelievably impactful. We're just outlining the jawline here. And what's fun about this procedure is, as many of you know, I have a very, very busy facelift practice. And when we do a deep plane facelift, we're actually identifying the masseter muscle for every single case. And so it's really fun to, as a surgeon and an injector, to be able to kind of make those correlations. So we're really, really accurate with our anatomy, which is frankly a tremendous part of doing really good filler work. It's really a really, really nice knowledge of facial anatomy and harmony. So it's really fun to make those correlations here. Just kind of allows us to identify the masseter muscle. It really is kind of a muscle that runs up here. And so we take some of that muscle out here and it just pushes this in really nicely. So let's do the masseter muscle now. Depending on the number of units, we use anywhere between 20 and 30 units per side. And we find this is a really, really nice combination. And people that have masseter hypertrophy, meaning their muscles are swollen or larger than normal or painful, they actually feel instant relief when they have this procedure done. And the reason that they feel instant relief is not the actual Botox, but we're actually placing the needle into the muscle, and it actually makes a lot of people feel really comfortable. It actually is a source of actual comfort for them. It's almost like, think of it as like when you do needle therapy for physical therapy. It's kind of the same thing, but we're doing physical therapy on the masseter muscle. So can we just flex your muscle for me? Bite down. Good. You can see it kind of pop up a little bit right here. And so we know we're in the right spot. On video it could look really scary, but it's actually pretty well tolerated.
Yeah. Haven't heard at all.
Here. So now we're going to do some tiny little pinches here. This is the crow's feet, or we talked about with orbicularis oculi muscle. So this is a little technique we do. We just put a little bit of Botox under the brow, and what that does is that gives her usually 2 or 3 millimeters of lift. So that should just lift the brow just ever so slightly, just creates this beautiful arch. Obviously when some folks have Botox, they don't have to raise their eyebrow, but I know a lot of people enjoy it, and just giving a little arch is just really elegant and really, really pretty. Do a little bit on the left side of crow's feet. And we use the tiniest baby needle. This is a 31 gauge needle, which is like really, really small. So generally this is not a particularly uncomfortable procedure. People do quite well with this. Now we're going to do the glabella, or the 11s. Once again, this is the procerus muscle here, and that produces horizontal lines. And the corrugator muscle is this muscle right here, and this muscle produces those vertical lines, or those 11s that we talk about. Once again, as a surgeon, I'm looking at these muscles all the time. So we have this really, really nice knowledge of the anatomy. We kind of know where they are. You see them in textbooks, you see them online, all that stuff, but there's really no substitute for actually getting in there and seeing them with your own 2 eyes and doing these dissections that we have to do during surgery. So it's been really fun to make those associations. Bruising is always a consideration for people. People always ask, so, hey, like, can I get this done? And then after I get it done, can I go back to work? Am I incapacitated in some way? And I can tell you that generally speaking, Botox in our hands, really causes minimal to almost zero bruising. People might have a couple little lumps and bumps temporarily. Those are like my little Botox bumps, and they last usually about a half an hour or so. And then a lot of people just go right back to work or whatever they need to do. I do recommend that people don't do any heavy lifting, straining, bending, any rubbing of their eyes too much for about 4 hours. But after that, people can resume normal activity. That includes working out, washing their face, applying makeup, whatever they need to do. Talk about a special filler that many people don't know about, and that filler is called Skinvive. Skinvive is a really, really nice filler. We enjoy using it here in our practice, but it's a little different than the other hyaluronic fillers. It's made by the same company that makes Botox and Jupiter, Allergan, so it's a reputable source, and we've enjoyed using Allergan products for many, many years now. Skinvive is a little bit different in the sense that it doesn't actually fill in lines. It doesn't actually plump up areas. So if someone has a line in their, let's say their nasolabial fold, sometimes we'll use a hyaluronic acid filler to fill that so the line isn't as deep. Oftentimes when people, let's say, have hollowness in their cheeks, we'll use another filler, maybe a Juvederm, Voluma, whatever it might be, to elevate the cheek and give them more body or more volume. Someone, for instance, who has thin lips or wants to modulate the size of their lips to enhance them, to make them pop a little more, that also is another type of hyaluronic acid filler. Skinvive is a little different. So Skinvive, I want people to think about hydration. So what that is essentially, instead of actually augmenting the cheek or the midface, we actually inject several different little tiny baby injections of Skinvive to each side of the face. And what people report is that it makes their face kind of glow. They have this silky, hydrated look to their face. Very, very favorable. Think of it as like an inside-out moisturizer. The duration of Skinvive is usually approximately 6 months, so people get a lot of good time out of it, and it really makes a big difference. You've had it before?
Yeah, I loved it.
Yeah.
I had more compliments than I've ever had.
The Skinvive, this is kind of like our spot where we like to see the most change. So we kind of do this area here. That's where I like to put it because I think it gives it the most glow. Good. And the beautiful thing about Skinvive is it's hard to even see, but the needle for Skinvive is the smallest needle that's even available. It's a 32 gauge needle. That is really, really tiny. So oftentimes when people draw blood or start an IV, That could be a 21 gauge needle, 23 gauge needle, something like that. Most fillers are with a 25 gauge needle. This is a 32, and as many of you could suspect, the higher the gauge, the smaller the needle. So a 32 gauge needle is significantly smaller than, let's say, a 20 gauge needle. So really tiny needle. Pain is really almost negligible. And the nice thing about Skinvive and a lot of the other products that we use is they're actually infused with lidocaine. So there's a little bit of numbness as soon as we touch the skin, so it makes it a lot more comfortable. Here we go, Jamie. And we just do this this grid, this lattice pattern here. And that allows us to get all that stuff in there for that great hydration and that great feel that she's gonna enjoy. Basically, that's the whole result right there. Really nice, and that'll just get better and better over time as the product integrates into the tissue. So we're gonna start the product on this side now. Here we go, Jamie. Pinch. Once again, 32 gauge needle, tiniest little needle, little scratch, nothing terrible. And with the Skinvive product and most fillers, really people can almost resume their normal activity right away. If you want to be extra cautious, a little icing is appropriate. That's totally fine. Keep the skin clean. Maybe people want to potentially not work out for maybe that day, but certainly the next morning they're absolutely fine to work out. They can apply makeup within an hour or two is totally fine. And that's it, pretty easy.